Colon cancer is the topic for this presentation. And colon cancer is pretty significant because it is, without a doubt, one of the most common cancers among men and women. Men and women, if you look at incidence and mortality, colon cancer ranks right up there. And I'm going to talk a little bit about incidence and mortality among cancers. And here we go. In terms of incidence, in terms of number of cases in North America, the most common, number one for men, is prostate. Most common cancer that happens. But for women, it's breast. And then the number two most common cancer in terms of number of cases in men is lung. And then in women is lung also. And number three for both men and women is colon, which is the topic for this video. For mortality, which is essentially the number of deaths due to cancer, the most common cause of death from cancer in both men and women is lung. Prostate and breast are dropped to number two in men and women. And colon is number three for both men and women. But here's the most amazing thing. In recent years, colon cancer has actually jumped to number two in both men and women in terms of incidence. So it's very important, very common, and definitely needs to be discussed. So why do people get it? What are some of the risk factors? Why would somebody develop colon cancer? Well, family history is a big one. Any type of cancer really has a strong genetic component to it. It can have a strong genetic component. So if your father had colon cancer, your mother had colon cancer, that can increase your risk of getting colon cancer. Other reasons or known risk factors include some sort of inflammatory bowel disease, like ulcerative colitis. I'm sure you all remember studying that. If you have this, this can increase the risk of cancer, especially if you've had it for a lot of years. The duration tends to increase the probability of progression to carcinoma. Low fiber diet. What you eat has sometimes something to do with it. Low fiber diet or a high fat diet. High fat. Low fiber, high fat. And then there's other risk factors that are not necessarily 100% guaranteed, but they are sometimes associated, and those include obesity and body habitus. But really the strong ones are these ones. Alright, so how does a person present with what are the symptoms? Well, so colon cancer is a very interesting one because because it grows so slowly, the symptoms are sometimes not present until late in the cancer, and by the time the symptoms do happen, the cancer is so advanced that it makes the treatment exceedingly difficult. That's why you do screening, and we'll talk a little bit about screening a little later on. So what are the symptoms? Well, if the person does have symptoms, you will have bleeding, rectal bleeding, bleeding in your stool, and there's a term, hematochezia. That's a blood in the stool, and the bleeding can, of course, as you bleed, if you bleed a lot, you can become anemic, and anemia can lead to fatigue and all the symptoms of anemia, weakness. Other things that are really important is the caliber of the stool. The stool is sometimes referred to as pencil thin as it comes out, and that change in the caliber of the stool, change in caliber of stool, this symbol is change, is also another big one. And those are some pretty hallmark diagnostic symptomatology. You might have abdominal pain, and you might even be able to palpate an abdominal mass on physical exam. also. So then how do you diagnose it? Well, by far the most common, the gold standard to diagnose it is a colonoscopy. You have to visualize the tumor. And like I said, this is also screening. This is also done as a screening test. It's done even if a person doesn't have any symptoms or anything, no bleeding. It's recommended that everybody get one starting at age 50. And if you have positive family history, then it's recommended that you get colonoscopy starting at age 40. Now, of course, if you have the symptoms, you'll need a colonoscopy immediately, regardless of age. And other than the colonoscopy, the other tests that are done are fecal occult blood test, CBC, to check the level of anemia. And then once the colonoscopy is done, the tumor will have to be biopsied to check the histology. And then once you diagnose a person with indeed having a malignant tumor in their colon, you most likely will have to do an abdominal CT to check for metastasis, to check for metastasis, whichever way you want to pronounce it, because a lot of times colon cancer can spread to other parts of the body, like for example the liver, and the abdominal CT will check that. Another common test that they do is a tumor marker called CEA, carcinoembryonic antigen. It's a tumor marker for colon cancer. So those are the tests involved. Well, the treatment is surgical. If this is the colon and the tumor was here, you would cut it out and then anastomose this area to that area. And the treatment, the surgery is often combined with chemotherapy. And the chemotherapy agents most commonly used are 5-FU, which is 5-fluorouracil, and leucovorin, which is also very commonly used. Leucovorin. And then sometimes they also add radiation to the treatment to improve the survival rates. So I wanted to show you a little diagram here. This is the colon, and initially a lot of times the cancers start off as polyps, which is here, and then later these polyps can transform into malignant tumors. And here's an example of one right here. And this is a nice little diagram that shows, that colon cancer is not just the colon, but it can also involve the rectum as well, and that can present with similar symptoms as any of the colon cancers have. So I'll finish off with a vignette. 59-year-old man has been having bloody bowel movements on and off for the past several weeks. He reports that the blood is bright red. It coats the outside of the stools, and he can see it in the toilet bowl even before he wipes himself. When he does so, there is also blood on the toilet paper. After further questioning, it is ascertained that he has been constipated for the past 2 months, and that the caliber of the stools has changed. They are now pencil thin, rather the usual diameter of an inch or so that was customary for him. He is also losing weight. He has no pain. Which of the following most likely diagnosis? Can't remember if I touched on this. Weight loss is also a symptom of colon cancer. Well, weight loss is a symptom of most cancers. It's not just specific, but it's part of it. And then we also have, the caliber of the stool. We have bloody bowel movements, stool, on the outside of that, hematochezia. So all these are characteristic of colon cancer. So the answer is B.